Hi, everyone. It was another week in Washington where Speaker Mike Johnson canceled votes and told members not even to show up at work. It's been nearly a month since the House of Representatives last met and took votes. That's why this week I joined a resolution that would require the House to be in session for a minimum of 5 days a week during any government shutdown. It's really simple. We don't go home until our job is done. At the beginning of the week, I was in DC ready to work together and figure out a way to reopen government, move forward, and protect families from skyrocketing healthcare costs. On Tuesday, I joined Democratic colleagues on the Capitol steps to underscore and share stories of families whose coverage will be in jeopardy if we don't act soon. Just like I've been hearing from families across New Hampshire, it's really clear no family can handle insurance premiums nearly doubling without being forced to make tough choices. No one knows this better than community health center leaders that I met with on Thursday. I talked with folks from Amoskeag Health, Lamprey Healthcare, Greater Seacoast, Harbor Care, and Bi State Primary Care. Congress must extend the Affordable Care Act premium tax credits before open enrollment begins on November 1st so that we keep healthcare costs low and that we don't force families to make tough choices between insurance and other basic necessities. I'll keep fighting to make that happen. Last Friday, the Trump administration began to illegally lay off federal employees. These were workers who run services like the 988 crisis line and critical substance abuse programs, disaster preparedness and disease control, and after school programs. Now, some of these workers were almost immediately brought back on because they realized what anyone could have told them that these people do critically important work for the safety and well being of our communities. And on Wednesday, a federal judge halted the administration's plans to fire thousands more workers. I'm also leading a call demanding that the administration reverse the layoffs that have been made at the Substance Abuse and Mental Health Services Administration, which runs the 988 crisis line and does so much more important work on substance misuse, and to return workers to the life saving work that they do. So this fight is not over, but I'm going to keep working to protect patriotic public servants and the vital services that they provide in so many critical areas to folks in New Hampshire. So thanks for listening. Have a great rest of the week, and we'll see you again soon.